Hello everyone, my name is Daisy. Welcome to Health Fun Channel, and in today's video we will talk about antibiotics and some important facts relating to this. Here where our presentation begins. Now in this video we will broaden your horizon about antibiotics and help you answer the questions: what is antibiotics? Why do you need antibiotics? When do we should use antibiotics? When do you should say no to antibiotics? Do antibiotics have any side effects? How many antibiotics are used nowadays? And how people differentiate them? Now, let's begin. According to the Cambridge Dictionary definition, an antibiotic is a drug or chemical substance that kills or inhibits the growth of harmful bacteria in our body. Don't you know that antibiotics is considered one of the most important medical discoveries in the 20th century? Before it were available, 90% of children with meningococcal disease died. Of the remaining children who survived from the infection, most of them had severe and permanent disabilities, such as deafness or intellectual disability. At that time, strep throat was considered a deadly disease, or even an air infection could spread to the brain and cause severe pain. In the 1940s, Alexander Fleming invented penicillin, which remarked the opening of the era of antibiotics. From then until now, there are more than 100 antibiotics developed, and they play an important role, if not to say irreplaceable, in treatment. So, when should we use antibiotics? Please, you should know that almost medicine both have a positive and negative effects on our body. So let's use it smartly. Antibiotics are only needed for treating infections in certain cases when the causative agent here is bacteria. For serious life-threatening conditions such as pneumonia and sepsis, or for the case of our body suffering from extreme response to an infection, antibiotics is the mainstay of treatment. Some of patients who are at high risk for developing infections include the ones undergoing surgery, patients with end-stage kidney disease, or patients receiving cancer therapy should use antibiotics as soon as possible. So, when we say no to antibiotics, not only infections are caused by bacteria. Viruses and fungi are also causes of disease in humans, and using antibiotics is born to the reason. Overuse or misuse of antibiotics is one reason for the emergence of antibiotic resistance. For the ones who have never heard about this terminology, antibiotic resistance happens when germs like bacteria and fungi develop the ability to defeat the drugs designed to kill them. That means the germs are not killed and continue to grow. More than 2.8 million antibiotic-resistant infections occur in the U.S. each year. This made antibiotic resistance become the leading cause of death in the world nowadays. So, do any antibiotics have any side effects? The answer is yes. Antibiotics can cause some side effects from mild to moderate level. Most commonly on digestive system, they include vomiting, nausea, you feel like you may vomit, or diarrhea, bloating and indigestion, abdominal pain, loss of appetite. Another notable side effect of antibiotics is that they can cause allergic reaction. Some symptoms of allergic reactions are a raised, itchy skin rash, coughing, wheezing, tightness of throat, and patients can use antihistamines when they have from mild to moderate allergic reactions. But when you have a severe allergy or anaphylaxis, you need immediately medical attention because this is a life-threatening situation. How many antibiotics are used nowadays and how people differentiate them? Like I said before, there are more than 100 antibiotics which are used in treatment now. Based on pharmacological properties and chemical structures, people divide antibiotics into about 10 classes. They are penicillin, tetracycline, cephalosporins, quinolones, LINCOMYCIN, macrolides, sulfonamide, glycopeptide, AMINOGLYCOSIDES, Carbapenems. Penicillin antibiotics. Another name of this class is the beta-lactam antibiotics, referring to their structural formula. The penicillin class contains 5 groups of antibiotics. This is aminopenicillin, anti-pseudomonopenicillin, beta-lactamase inhibitors, natural penicillins, and the penicillase-resistant penicillins. This class is usually used for respiratory infection, and amoxicillin is the one of most prominent representative of this group of drugs. For tetracycline is also a class of antibiotics commonly used to treat urinary tract infection. The class is not decreased in children due to negative effects on bone as well as teeth development. Doxycycline, tetracycline are medicines belonging to this class. Cephalosporins are also antibiotics that are used in prescription to treat strep throat infections, urinary tract infections, skin infections, lung infections, and meningitis. Now there are 5 groups of cephalosporins. This class has same mechanism of action like penicillin. About fluoroquinolones. Fluoroquinolones or quinolones are the class of broad-spectrum antibiotics commonly used in adults. This group of drugs is often indicated in the treatment of sinusitis, bronchitis, and uncomplicated urinary tract infections. The drug has many side effects and is not indicated for the treatment of children. Ciprofloxacin or levofloxacin are antibiotics of this class. LINCOMYCIN. This is a class of antibiotics that are mainly active on gram-negative bacteria. It is prescribed in treatment of serious infections like pelvic inflammatory disease, intra-abdominal infections, lower respiratory tract infections, and bone and joint infections. Some antibiotics classified into this class are LINCOMYCIN, clindamycin. Azithromycin, clarithromycin are antibiotics belonging to this class. MACROLIDES are usually used in treatment of uncomplicated infection and could be an alternative to beta-lactam antibiotics in case when patients have allergic reactions. 5 macrolide antibiotics are currently available for use in the USA. Sulfonamides can be seen as an old class of antibiotics because its resistance is widespread. sulfamethoxazole and trimethoprim or Patrim, a well-known name, is a sulfonamic antibiotics. Glycobacteridine like LINCOMYCIN is used to treat MRSA infection. And for aminoglycosides are often toxic to the kidneys and eyes. And this is a group of bacteriostatic antibiotics whose main route of administration is injection. And the last group is Carbapenems. The injectable beta-lactam antibiotics have a wide spectrum of bacterial killing power and may be used for moderate to life-threatening bacterial infections like stomach infections, pneumonias, kidney infections, multi-drug-resistant hospital-acquired infections, and many other types of serious bacterial illnesses. They are often said for more serious infections or used as last-line agent to help prevent resistance. And that's all information about antibiotics. Thank you for listening, and if you have any questions, please comment below and we will answer as soon as possible. Thank you. Please subscribe and info to have more information. Thank you.